Send it, and tell the first, doctor company down Osceola, down by the river.
Here we go.
So it's 9 a.m. and I would like to call our meeting of the Polk County Health and Human Services Board to order. Roll call, please.
Francis Duncanson,
Here.
Price,
Here.
Brad Olson,
Here.
Pam Garvey,
Here.
Tony Johnson,
Here.
William Oliva,
Here.
Rita McKee,
Here. Here.
Dr. Rebecca Lang.
Here. Okay, good morning, everyone. With that, I would entertain a motion to approve the agenda.
I so move to approve as presented.
Second.
Motion's been made and seconded to approve the agenda. Any discussion? It appears not. I'll call for a vote. All in favor, aye.
Aye.
Opposed, same sign. Okay, moving on. Item number 4, approval of the minutes for the August 12th, 2025 meeting. I hope everybody's had a chance to review those.
I'll move to approve the minutes.
I'll second it.
Okay, motion's been made and seconded to approve the minutes for the August 12th meeting. Any discussion? No discussion, and with that, I will call for a vote. All in favor, please say aye.
Aye.
Opposed will be same sign. Motion carries. Agenda item number 5. Do we have any public comments either online? It doesn't look like there is anyone here in person. So speak now, please, or forever hold your peace, so to speak. Okay. Doesn't appear we have any public comments. So moving on to agenda item number 6, receipt of information from supervisors not seated as committee members. It does not appear that we have any supervisors here in person. Do we have anybody online? I can't read that far away, but it doesn't appear that we do. Okay, so we don't have anything going on there. Agenda item number 7 would be our update regarding the public nuisance ordinance and discussion on that.
Sure, I'll give a brief update that we're still collecting our information, I'd say. We are working on some ongoing cases right now. And I was able to learn more about jurisdiction as far as the county health officer versus some towns and cities have a health officer written into their ordinance. However, the state DHS gives Helen authority for it to be a health officer, and there is not authority for a health officer passed down to townships and cities unless they have the same structure as a HHS committee and stuff like that. So in Polk County, I am the only health officer, so that has changed some of the wording that we're looking at and direction that we're moving. So I'm also reaching out to some first responders and fire chiefs as far as getting more information about hazards related to first responders, if they're, the public going into a home, what they would be concerned about, and taking some other points into consideration as we work on not only the ordinance, but then our internal public health process strategy, that type of stuff. So more to come.
Okay, so that's another piece. Supervisor Olson.
So I guess I can only say how disappointed I am in this. I mean, having sat here for 6 months, this has been on the agenda, every meeting for 6 months. And yet back in May, Supervisor Garvey had 3 things she asked to be changed on it, which from my understanding was approved. And yet 4 months later, we sit here and nothing is in front of us. We talk about this every month. It's the same discussion and yet nothing has happened. And I guess I sit here and I think, having spent 8 years on environmental services, these things came to us and the committee made changes. The staff took them back, brought them back the next month. We're still months out from anything happening, more than likely from the time this gets in front of us. And to be 6 months into this process and have nothing in front of us, we've actually gone backwards. At least for 2 or 3 months, I had it in my packet, ready to go to come and speak to things that I thought were wrong within the ordinance that we have today. And I just think if we're not going to discuss it, if it's not going to be here, then it shouldn't be on the agenda even. Don't tell me every month that we're going to have it and then we're going to have discussion, but it's not here. If it's not ready to go, and At the end of the day, it is our ordinance. It's the people's ordinance. No offense to staff. It's not the staff's ordinance. It's our ordinance, it's the county's ordinance, and it's the staff's job to enforce that ordinance. And Corporation Council's job to make sure that what we put in it is legal at the end of the day. So once again, I just cannot say how disappointed I am in the length of time it is taking for this process to get in front of this committee.
I would just like to say that I appreciate and I understand your kind of your frustration with this. Seems like we started out with one mission, and that was language cleanup. That evolved into maybe 3 or 4 changes, and that evolved into kind of reviewing and looking at the entire ordinance. And I think that also has contributed, to the time factor. But yeah, I understand your frustration, and if it's not ready, we don't need to have it on the agenda.
John's got.
Madam Chair.
Yes.
Yeah, and this has been over 20 years. This has been kind of the number one topic. It really starts with the township, like you've had experience with the township and the town clerks and the town chairs, they get complaints about everything. And then when we had discussions on this before, then from there, the next step that we have to do is with the sheriff's department, because it all comes down to what you can legally get through the sheriff's department. Well, how they can issue a citation, we can have everything written we want. But when it comes down to citations and going through the sheriff's department and going through our courts, what legally we can do. And there's a whole lot of really down to the root things, and I don't think we've gotten down to some of those things yet, because that's where it really lies. What you can legally do, we can sit here and have all our ideas but we got to get down to what we can legally do, right?
Supervisor Garvey.
So I did have a conversation a little bit with Helen and Tanya about kind of where we were at and, talking about kind of where this started. It started because they wanted a language cleanup. And if we're going to clean up language, that's specifically where I came forward and said, okay, but we're not eliminating some of these things. And then in the visit was that continue to find, opening it up, finding more issues, finding more concerns. And I don't know, and it's just in thinking and listening and stuff, is there a way that, if I understood Helen correctly, that there is a lot of things that possibly need to be changed and need to be cleaned up. Is there a way, though, to compartmentalize any of it? Like, as far as from where we started working on this piece and have a goal for this piece, or is it too intertwined? And that's what I don't know the answer to that question. But I know that we started with, one piece. And as you got going, it's like, oh, then this is an issue. And I totally understand that, how that followed. Is there a way to possibly break it down to individuals again, or not really? That would be the question. And then possibly say, okay, because I can see how it's like, oh, there's this. And then all of a sudden, well, then there's this too, because it becomes an awful big bear to deal with, and all the different layers, like you'd said you'd found with townships or cities as far as what powers they had. And that is a whole nother set, it gets into your entire scope of your job. And is there a way to break it out? To go back to even that little piece that we wanted to clean out to start with. It's just something as we're talking about, because that's kind of where we started. Is there a way to still do that little piece or that piece, or are they too intertwined to not compartmentalize them?
We could move forward just with those initial wording changes that we had discussed that would reflect the elimination of the nuisance ordinance ruling, evening it out with human health hazard, and just bring that up. Mm-hmm.
I mean, it was just a thought. I mean, I know, like I said, because there is a ton of stuff that gets, or is it too, are they too intertwined?
Like Helen, I know, like your noise ordinances and your junk ordinances and old cars and that, and like the town gets the complaints, and legally, you as a health officer, when you can issue a complaint that there is a, really a health issue here. Those are the only things that stand up in court. And
Those are the things that we wanted to remove because we cannot enforce. So that's the language cleanup. That
And
goes-
all the things that we write on
Maybe
paper
in the
mean
sheriff's
nothing
department.
unless we can enforce.
We can clean that up and what we're doing is unpacking the last 20 years of when the ordinance was written. So if you want to just do the language cleanup, we can do that. We still have to clean up the human health hazard statute. DHS requirements have changed over the last 20 years. So we're in a little bit of a bind with being able to enforce our human health hazard as it's currently written. So we do need to clean that up. But if we want to address the public nuisance piece, we can do that. It's up to you guys.
Rita?
I don't, oh, I'm sorry.
Oh, I thought you had your hand up. You didn't even show your hand.
For her to raise my hand again too, so.
Thank you.
So I think a good piece of the puzzle here, I guess I would ask Corporation Counsel for some advice on what needs to be updated and how to enforce it.
That's number one.
So the way the ordinance is currently written, the health officer and people that she designates to work for that department are the enforcing agents. John talked about the sheriff potentially enforcing any of these things. The way the ordinance is written, it doesn't actually provide any local law enforcement the authority to enforce our public nuisance ordinance. So all of these particular ordinances are only enforceable by that department or some other agency or department or officers that this committee assigns to have that authority. The way it's written, they're the only people that can enforce. So the sheriff can't enforce these noise complaints in this particular ordinance. The sheriff's office can't enforce abandoned vehicles or excessive number of pets from this particular ordinance. We might have it somewhere else that they can enforce, but under this ordinance, they can't enforce it. So the reason it originally came to this committee for elimination was that public health in their enforcement capacity enforces through the human health hazard ordinance, which is something that developed years after the public nuisance ordinance developed and was a more specific way to address a lot of the same concerns. Additionally, this board, since the public nuisance ordinance was adopted, has adopted shoreland ordinance and other zoning ordinances that address some of the same things. And so the main reason it came in front of you to begin with was this ordinance, the way it's written, appears to have last been modified in 1983. It isn't useful for the county anymore. Then concerns were raised, well, if you eliminate this language, that is going to, this language helps clarify other language in the ordinance, and that was raised by Supervisor Garvey, and I believe Supervisor Olson had the same concerns. And so because of that, that's when we started getting in this more in-depth conversation about, okay, well, if we're not going to remove it, how do we make it something that's useful? How do we make it something that is then applicable to the county? Because we're not issuing citations for any of this stuff. It's just not being issued because noise isn't something that we have a way to quantify. We don't have the tools. We don't go out there with a
Decibel reader.
Decibel meter.
and measure whether something is putting off a certain amount of noise. Theoretically, we could, but that would.
We refer to the sheriff's department for disorderly.
Right.
They go out there, tell them to quiet down. If they have to go out there again, they're gonna cite them for
Disorderly
disorderly,
conduct.
possibly.
And then there's citation level disorderly conduct, which would usually be a noise violation.
Mhm.
There's criminal disorderly conduct if it's something that's too rowdy, et cetera, et cetera. And so we have found alternate ways to do the same things just without using this particular ordinance.
I didn't mean the sheriff as the enforcer, but doesn't the county write the citation and then the sheriff or department or is the designee deliver that citation?
Nope. So the health office would issue the citation and then that citation would either be delivered or usually mailed, is my guess. Mailed out to the person who owns the property. That is the problem property. But again, we're not issuing those citations under this ordinance. We have a different ordinance that we use that
I
has,
guess some of that stuff has changed.
that even has more teeth a lot of the time, which is why we use the ordinance instead. Hope that answers people's questions.
Supervisor Olson?
So this is not because I want to see this hurry up and get done. I don't care how long it takes. What I care is that as a committee, we know what's being done and we know it's being done on a month by month basis so that we can either say, yes, we like this, no, we don't like it. I mean, if it's the law, it's the law, right? Doesn't matter if we like it or not. But those things, I don't want to see it come to us at the end of the day. And then this committee say, well, really don't like what you've done here. Really not in favor of it. Don't like the language, all of this. There again, sitting on the other committee, we'd spend literally months and months and months working on things. And there again comes my disappointment of looking at it for months and never seeing it. So tell me a little bit at a time what it is we're doing rather than saying, here, we just changed 700 things in it. Now we have to go through every one.
So if I understand correctly, Brad, what you would like to see is we review it a chunk at a time instead of getting the whole product when everything is done.
Yeah.
Okay.
Or even if not a chunk at a time, just go through it, because there again, we started out with some word changing and some definition changes. And apparently that has grown and grown and grown, and yet I don't know that any of us sitting around these tables know what any of those changes have been. And I want to know what those changes are as we move forward so that they're fresh, they're relevant, and we can say yes or no, or hey, here's what we're looking at, but maybe this committee says that's not the way Polk County wants to go
So
on that.
I guess a question I have for Mo or Joe or whoever is, how does this work? How does this kind of function? We're not going to take a chunk at a time to the county board for approval or for public hearing for approval, but within this committee, we can look at it a chunk at a time. The committee agrees on that piece and we move on to the next piece. I do have a concern if the ordinance, is from 1983. No time like the present, I guess. I know it's a big animal to take on, but if it's been that long since it's been looked at, I guess we can kick the can down the road and not, look at the whole thing. Or we can look at the whole thing a piece at a time, maybe more palpable, but I don't know how the rest of the committee feels about that.
Well, I think it'd be helpful just to get a red line version out of what the information we have currently out there. And then as new information comes in, change that as we find out more information so that you're working off a red line version moving forward instead of just getting a verbal one on that, just get a red line out there. And in the side notes, you can highlight pending information on this for XYZ. And then get that information out so you kind of know where you stand as you're going through the rest. It may take months again, or.
Oh, yeah, but I think it more than likely takes months if we look at it all at the end of the day. And it doesn't mean that you can't back up and change something that you've already looked at, but.
And then if you have questions along the way, they can be taken until you get to that end document.
Yeah, I guess if we wait till the end, we're going to have
A lot of
a
questions.
lot of questions. So, Bill?
So looking at this ordinance, there has to be easy parts and there has to be difficult parts to it, just reading it through. So my question would be, I'm looking at Article 2 in here, which is food, lodging, and recreational facilities. How much has changed since 1983? We still issue permits, etc. Is that an easy part? And then I get to the second part of that, Division 2, which is permits. How much of that has changed? We still issue permits for food vendors, etc. So looking at it for the subcommittee that's looking at it, can you take the easy parts first and then to save the worst for last. So they can come back to the committee. So Supervisor Olson could say, okay, we did Article 2. Here's the changes in Article 2. Here's an update from the county on our permitting, information, food, lodging, et cetera, and then move on from there. And then when we get to the public nuisance part of it, when you start looking at interpretation and definition, now there's going to be room for discussion. And again, I would defer to Corporation Counsel because he's going to know the easy and tough parts of that ordinance.
I think getting the red line version out there gives opportunity for staff to ask the question if there's a certain part of the ordinance that we just need guidance on which direction the committee wants to go. We don't spend a lot of extra time
Right.
going down this road when we go down that road.
So we have a redlined version. You guys want to pick up from there and have this turn into a working committee next month? Is that what I'm hearing?
We can put the red line version in front of them and so they can get it and get information to them and see if they have questions on the current red line.
So we did that and then we formed our quasi subcommittee with Supervisor Garvey.
But I think too, it's important, I mean, for us to see that as a committee,
Right.
but also for staff to realize what other questions that are within the whole ordinance, what are questions that this committee has of why is this here? Has it changed? Whatever. Because there again, if we're looking at something that's 20 years old, it may not even be relevant to what's in black and white on the sheet of paper. But we need to know that. And if it is relevant, they need to know which direction the committee and the county wants to go.
Supervisor Bumper.
I guess that's where I'm confused. So we still got this 1983 that's in force now. And going back to the timetable, what did we want to change and just going through as we see the timetable as up to 2025. I don't think it should take forever to make the changes off of our 83 plan.
Rita.
I do have a comment regarding what Corporation Counsel mentioned regarding the new ordinances, the new laws that now have been and subsequently. What are those? Could we get a list specifically of what those things are and how they affect us? Because I didn't realize that.
So the public nuisance ordinance is under chapter 22 in our ordinances. What Mr. Oliva was talking about, the food, lodging, and recreational, that's all under the human health hazard, under health and public welfare. Those ordinances were passed in 2017. So even those ones are 10 years old. The chapter 22 was passed in 1983. And then zoning, which is not under this committee, it's under environmental services. They have a lot of other similar provisions because a lot of these things have to do with the use of your property and what you're doing on your property and whether it's causing problems for other people. And a lot of that falls into zoning. That falls into chapter 42 of our ordinances. And those are updated very frequently. The shoreland ordinance is modified probably every other year, if not every year. Those things get tweaked as time goes on. The law, as it relates to that sort of property use, changes pretty frequently. And it's not going to touch on the same sort of stuff as the nuisances, but I can try to put something together that highlights those things.
But a lot of the changes that would be made would be because of new rules and new laws within it, within the red line version.
Right.
Oh, I see.
Everybody's nodding their head. Phil, did you have another?
Well, just follow up on the comment there. In the original that you gave us way back on page 16, under that public nuisances generally, you had comments in there as to where those were followed up with new legislation.
You wanted it crosswalked.
Right.
We
Yep.
crosswalked
Yep.
it
Yeah.
Correct.
where it would
So-
be enforceable because we didn't believe it was enforceable under,
So
well,
and
it says it's enforceable under our jurisdiction, but it really isn't.
right. I
Hard
would
to
go back to Mr. Norby's comment. Let's take a look at that red line, see where we're at, and then go from there.
So if I want to make sure I understand what the committee wants. next month, we'll have an agenda item as a working item to go through the red lines. So you guys can bring your questions and we can make purple lines or whatever color of the questions. We'll do our research, bring them back every month so that we can clean it up to your specifications. Is that accurate?
Does that sound like, do we have a consensus
And
on
according to
that?
what corporation?
Seem reasonable?
Yeah, Pam?
And you were thinking about the red line that we had way back the last time we met, but because I was thinking you also found there were some concerns even with those updates. So even that red line that I have is going to have to be different for next month. You know, that, because we thought we had a pretty close, and then I know you found some snags. So I'm just thinking as far as even as I'm looking or understanding.
We can.
And I also want to throw out there that the fact is that this was brought because of a need to clean up, not because of a current issue. So not that we still don't need to clean it up. I think there's also some benefit in the fact that there isn't anybody knocking on our door saying, where is this? What's the answer? Versus
Yeah.
shoreline when we're fighting that all the time. You know, that I do think that there's some decent, some positive in the fact that let's get through it and get it right. But yes, I think it'd be nice to be able to see like, you know, this is what we found here, because I know, like you said, as you keep going, it's like, oh, well, what about this? And what about this? And I can't imagine how crazy sometimes that's got to be as far as how that then refers back to other pieces when it just started with, you're going to take this language out over here. I want to make sure there's coverage over here. That's where it started. So.
Well, I don't think we need a motion on this, do we? It appears through discussion that we have a consensus.
Karen has it recorded.
For here. You know, as long as we have a consensus, that's what we will move forward with next month. And I'll just reiterate that so we're all on the same page. We will have a new red line version available, and we will start to review that as a work session at our meetings, one piece at a time. Okay, that sounds good. Thank you for bringing that up, Brad. So agenda item number 8 would be an update from our crisis ad hoc committee.
I believe that this committee wanted this item on one more time for a final
Yeah,
update.
I think it can leave.
I don't really have an update. I think the last we heard from the legislators is that they're just waiting for any county to apply to be a crisis care facility. I don't know that there's any out there that are applying at this time. Do you have any updates, Mo, that you want to add?
Just that you and Dana Reese met to look at one of the wings down at Golden Age Manor to see if that would be sufficient to open up a facility for us to get some of that money. But that comes with some more in-depth digging to see if that would jeopardize our nursing home license and how that would work, because it's tied to the same building, would have the same food. Kind of similar to the central kitchen idea with putting meals out of there. So we are looking to tap into the money and how that would look. So once we have something to bring back to the committee, we'll put it back on the agenda. But I think it can sunset for right now.
Okay, do we have anything else from anybody on that? Does not appear so. So we'll move on to agenda item number 9 for 2026 budget presentation.
Yes, Madam Chair. They go through each committee, presenting additional funding requests that departments had, jurisdiction, none of the committee. We had over $6 million of extra funding requests to go through for approval on that. And we do have some things from the department heads on some of the changes in the budgets. That's just to make you aware. This committee, short list on there for additional funding requests. We had capital projects and operating costs. This division had operating costs. These are 2 that I approved for funding requests. One was for a halftime transportation coordinator, ADRC. That is grant funded. That comes out of their grant, so it's no impact on our levy. The other 2 were CSD positions, which are also grant funded. So these are no impact levy or no impact to our levy. These are two positions that are grant funded. So without the grant, they don't have the positions.
So how long is the grant good for?
These are placeholder positions for us that, as we are continuing to restructure, they're not grants, they're state contracts. So it's, they're CCS positions that are 100% funded by the state. So.
Okay,
And if we don't have the contract, then we don't have the position. So
okay.
other than that, coming to September board meeting, then it'll be my proposed budget, utilizing, you'll see all the extra funding requests that came through, along with the ideas for borrowing and utilizing the general fund for funding.
All right, probably, I'm just gonna say probably a stupid question, but I'm just continuing on that. You said those are state funded by a state contract. Is that like totally completely funded, like benefit, all those type things? So there's literally, and then if you don't get it, those positions are just eliminated. Is that?
So it's
or-
Medicaid funded and
Okay.
it's, we throw everything but the kitchen sink into those positions. So we get my cost covered, Kathy, rents, everything gets covered in those positions. So if we don't use them, we just don't get that revenue.
Got it. Okay, thank you.
And that's all I have for the extra funding request for the HHS committee on there. So otherwise, I believe Connie has some slides if you have
Kathy and
questions.
I will tag team.
Take team on this so they can,
So you guys had asked for like the highs and lows of our budget preparation for 2026. So
Claire, can we do the graph one first?
and it's in your packets, I believe. So this one.
I actually had this one done before we talked about kind of those highs and lows. So this is kind of just a recap of where our budgets for CSD have been from the actual in 2022 to current. So the first graph here just kind of really shows our revenues and expenses, the actual for the first 3 years and then budget amounts for 25 and 26. So as you can see in 22 and 23, we actually gave money back to the general fund. It was just almost 1.4 million in 2022 and then 900,000 in 23 that went back to the general fund. We had a lot of COVID dollars then too, which kind of offset that. So just making some assumptions, plus overall placements were down. So it's maybe slightly skewed why we were able to give so much back, but I just wanted to still look at what that looks like. So the next graph just shows where the general property tax levy that we get each year for CSD. So it has increased 181,000 from 22 to, and we got the same amount from 25 to 26. So it's about a 3.75% increase. So our levy we get is just over 5 million or about 35% of our budget. Next graph shows our staff. We have our staff costs, which are the blue, and then our FTE. So our staff costs have increased by 42%. But we have decreased our FTE. So after the AFR, because this was before I knew they were completely approved, we will actually end up being at 95.475. Because we do have some casual like nurses that help out with our flu clinic. So that's why we have that weird FTE count in there. So again, back to 22 and 23, FTEs were a little bit higher too, because we had a lot of casual, or not casual, but we had the LTEs helping out with COVID. So again, some of that data is skewed. So in 23, we had the wage study. So all staff received at least 5%, but we did have a staff member that had an increase of 18.86%. In 25, dental and HSA started being charged back to the budget. And then in 2026, we had the 15% increase in health insurance. So staff costs though are 63% of our overall budget.
So what does that red line really mean?
That's the FTE. So the number of full-time equivalent staff we have.
Thank you.
So it, again, higher in 22, 23, because we had those extra staff that were helping out with COVID.
I always wonder about red lines.
Yeah,
Yeah.
no, that's just showing the trend down that we have. But again, it was a little bit higher those
Been there.
years because we were still had COVID staff with whether from staff helping with giving the vaccines to doing the communicable disease tracking. So just kind of a snapshot of where we've been.
But even at that time, the cost with the higher FTE was considerably
Yeah.
lower than what it is now. with
Yeah,
The departments absorbing those health insurance costs,
Yeah, even though,
wage study had an impact, so we
Yeah.
were seeing a higher staff cost with a lower FTE count.
yes, you can see the FTEs trending down, but we still continue to trend up with staff.
And you'll see that, that's probably true for all departments
Yeah.
across the county. You'll see the very similar graph if they put it out on
Mhm.
something like that.
So question, so I know there's been talk about the cost of health insurance, and so 15% was the number that was landed on? Is that, but so is that going, so that's going back to the department is trying to absorb that versus staff individually trying to absorb any of that? Or
15% on both sides.
15% increase for health insurance on both sides, a 30%,
Employer cost and employee cost.
30% up.
30% increase in health insurance cost.
Well,
Well, it wouldn't be that, ma'am, because it's, the employers pick up something like 70, the department's about 76% of the cost.
Right,
So-
okay.
The overall, our healthcare costs, we're budgeting a 15% increase overall, shared as equally as we can by departments and by staff members.
What was that percentage,
You
Don?
said 15,
15.
15.
so then it's not 15 for staff as well.
It's overall, as we balance out how much we pay for each one, it's a 15% increase equally between employees and employer.
Okay, so in theory, 7.5.
Right, that's what I'm trying to get with Brett.
We budgeted 15%.
There's 15% more budget in our budgets for staff insurance.
To cover your staff insurance.
So are we both confused, ma'am?
Yeah,
Because-
so is the individual then also paying 15% more out of their pocket?
They're paying.
Or are they
the
paying
increase-
7.5% more?
Okay, maybe I'll explain it this way. The increase for healthcare is their premiums are going up 15% on
Okay.
their share.
Of the 20% that we pay.
The employer increase is also 15%, not 30% on the whole plan.
Okay.
But we each one got a 15% increase.
So we might be paying 70% and they're only paying 30%. So on our side, it maybe goes up $100, but on the staff side, it's maybe only $20 because their percentage of what they pay.
Sure, is usually,
Yeah.
right, that's where you,
Yeah, what Don
70,
was
30,
saying.
yes,
Yes.
I get that, but.
Yeah. So it's not really a 30%. You would have to add them together. It's maybe more like a 20% increase.
Got it.
But when you look at percentages
Right.
on individually,
But your budget, you are increasing your,
On our-
try to make
yeah.
your budget work by 15%.
They're saying, but
no, well,
What?
Just like the other departments are all doing the same thing.
I'm not sure. I guess I don't know what it's showing up on staff side. I just know what's in our budget. And our cost on the budget side went up 15%. What our department's spending. I don't know about the staff.
We're still basically self-insured with
Yes,
a cap policy.
we are self-insured, yes.
Okay. There were a couple of good years, couple of bad years, is kind of how that whole thing shakes out.
Right, we've had 3 bad years in a row right now, where our health fund was at $8 million, ended last year at $2 million, projected to go lower than that. Good news was our stop loss, instead of projections out at 2.2 million, came in at 1.8 million, which saved us. Currently, we're trending about $500,000 better than projections hit. Throughout the year, we've had some high claimants drop off our system. Things are trending fairly well for us. The final numbers of the plans themselves haven't been totally solidified yet, with the exception of the 15% with that for the budgeting purpose of that. So I'll be honest with you, it's the thing that keeps me up at night most of all is trying to get that, because it's going to take, it's something that we can't fix in a year. It's going to take a trend to fix that thing, to come back, get our health fund back where it needed to be, after a combination of decision events all come together at one time to really cut down faster than we.
Supervisor Olson.
killed us.
So over the last 3-4 years, whatever it's been, has there been, I mean, at any point when we were at $6, $7, $8 million, excuse me, did we freeze the increase to employees that has stayed frozen until recently now?
Last year, there was a slight increase. I believe it was 10% that came from the employees, but it was froze for a time. In addition to that, employer contribution that went towards our healthcare was lowered also, and then taken out of the health fund instead of the normal, keeping it out there. So instead of the budgeting $5.5 million, they budgeted, I'll throw out a number, 4.5. You took that out of the health fund versus budgeting for that increase. So a combination of that, high claimants, no increase in premiums, sent the fund down quicker than anticipation.
So if I recall correctly, the county's auditors reviewed that health fund pretty thoroughly. And at the time it was frozen, their recommendation was that that fund was plumping up and getting pretty high, and that we should freeze that. Well, and then just about the time you freeze it is when you get the big hit with the big claims, I think is kind of a way to recap it.
Yes, and so in recap it exactly. So instead of drawing it down 2 to 5% a year to maintain and stabilize, and that it went down 25% per year. Compounding as it went through.
Headache everywhere.
Healthcare is very expensive.
Sure is. Do we have any more discussion on that piece of it?
Got some, that didn't come up. Our first page did not come up on the slides of savings.
That's because I haven't, we
I'm
haven't.
not there yet.
Okay, oh, well, see, you jumped ahead of me.
It's out of order. It's okay.
I didn't tell Karen what order I was doing it in, sorry.
Is that our next thing to
Yep,
review?
so
then?
and I just have it's a different document. So I believe at the last staff meeting, you kind of, or staff meeting, sorry, board meeting, we talked about like how did we get a balanced budget? Where were the highs and lows? So this is just a recap of what we did. Because I think when we got our initial budget from admin at the beginning of the budget season, we were short about 435,000 overall for CSD. So we just recapped here the kind of like savings, revenue increases, and then just some other information on there. So our first piece we have here regarding savings is we looked at staff, obviously looking at not filling positions or eliminating positions is really the last thing we want to do. So with that, we did eliminate our marketing and outreach specialist position. And then we had several different nurse positions between public health and behavioral health that we are not replacing. They're on hold. So if we kind of that funding piece, that kind of like the AFRs we had, if we have that funding for CCS, we may shift them to use them elsewhere. But right now we need to have funding for them first to do that.
We've been able to hold out for the last few years and not eliminate positions or not fill positions. This is the first year that we've actually had to eliminate,
Correct.
RIF a position,
Mhm.
reduction in force, and hold those positions and not fill them. So that's different for us this year. So
Yeah.
hard decisions needing to be made this year for 26. And our marketing position, we're happy to report that he found a dream job. And he's going to be leaving employment soon here. So we're happy that he was able to find something that really is a good fit for him.
It is a
So,
good fit, so.
it worked out okay.
And then we took a look at, we have a variety of different contracts for contracting services or that, so just we're able to consolidate a couple contracts, which had a savings of about $80,000. And then on the other side of being able to increase revenues, so we had our environmental health fees, so we took a look at what are we providing, are making sure that we're capturing our staff time for doing that. So that's about a $33,000 increase. We also are contracting out our birth to 3 services, whether it's to other counties or schools. We are billing back the jail our actual cost, where in the past we just were billing them the Medicaid rates, so that will be an increase. We're looking at increasing how we're maximizing billing out to our third parties and increasing that revenue. And a piece we had Mendota and Winnebago, they have been really, we always pay in full and then they always try to back bill to insurance and they've been able to collect a lot more. So we increased that just to reflect what we're actually getting back from Winnebago and Mendota after they bill. And then this is just kind of a recap of the staff increases, what that increase was for us this year for wage, WRS, and health insurance. I also took a look at our different grant and state funding, and overall it was about 134,000. Some of this, our grants change a little bit from year to year anyways. So I can't say it's necessarily because of the big beautiful bill or other things going on. So 15 different grants. They had like I said, there was only one program that was completely cut, and that was Fit Families, and that was $18,000, but our biggest gap was for our Well Woman program. It decreased by about 50%, which was $30,000. So again, there's still some unknowns that may happen. I think a lot of them might not happen until 2027 though, so we might not see that for the 26 year. And then the other thing that we just got an email last week about the Mendota and Winnebago costs going up by 10% starting in this October. So just based on what we budget for those programs, that could be additional 55,000 that we may be spending that's not budgeted right now. So an example, when a person first goes for their first 3 days, or if they're there on the weekend or a holiday, that fee is going from 1,969 up to 2,166.
That was 2,300. You know. Per day. Per day. Per day. Yeah.
I guess I was just looking at the rate sheets that they had, and that was the dollar amounts they had on the thing.
Anyway,
So
10%.
10% increase. So yeah.
So what happened to Governor Evers? What was it, $500 a day or whatever? What was that?
That's the youth
Yeah.
correction side. This is the adults commitment.
Yeah.
Thank you. Okay,
It was all used, yep.
got it.
Fred.
So on the increase in behavioral health to third parties, who's the third party that we're billing?
So with a lot of our programs are Medicaid programs, so we bill Medicaid, but then also with our clinic and some of our other services such as crisis, we can bill other insurances, health partners, Medicare, Medicaid. Our clinic providers can also bill for Medicare. And then it is potentially billing back to the client too. We do offer ATPs for any person, even if they have insurance. So if they cannot afford to pay for their services, they can come in and do an ATP.
It's like a sliding fee scale.
Yeah, and based on their income that they get each month, we can adjust that, and then they pay that amount. So it's just billing out to the insurance, which we do now. It's just increasing it, maximizing those services that we're billing.
Okay, so then not replacing the behavioral health nurse, is that one nurse, two nurses?
So behavior health had 3 nurses, so we're going down to 2.
So that's my understanding that a department head recently left. Is that position being refilled again or?
Which one?
The department head one.
That right now we're doing an interim plan to see if we can make a different management structure work. Anticipate knowing by January-ish if the different structure can work, and it's kind of a step down, partially because clinicians are hard to find. And then also with budget impacts, we want to see if we can do it in a lesser cost way.
Yep, okay.
But that was not a nurse.
No, right.
Yeah, so that position is still in the budget though also. It's so not because that was after we had the budget piece
Okay.
done. And then back to the Winnebago Mendota, I have a note here. We have not actually used Winnebago or Mendota a whole lot, so that's good. But for the, I know, shouldn't say that, but the 3 for like that 3 hold thing so far through this, we've only used 10 days of that amount. So, and I think last year we had 28 days where we used in that higher dollar amount bucket.
So
But that can change.
just curious on a practical matter. So if you look at, you lose 133,000 on grant funding. So what does that look like on a practical matter as far as, is that then so those programs, like, or you said the Well Woman was cut in half. So does the services of that program get cut in half? I'm just kind of curious, like, what does that really look like in your offices with your people? Does that mean people's jobs shift? Does that mean people, or they pick up something else that was removed? I mean, you know what I mean? I'm just curious, kind of, what is that?
Variety of things. So like for Fit Families, that was partnership. Helen, if I say something wrong, jump in. Fit Families kind of went with WIC. It was an extra add-on program for families. They would create goals for the kids and the families, and then we. Exercise nutrition goals. Yes, so our nutritionist did that. So yes, they will have to shift to provide either do more WIC services, or they may potentially come out of the general public health budget and do other services.
Got it.
For Well Woman, that we don't actually really provide services on that. It was more our staff connecting people to that resource and doing a lot of outreach with it. So it necessarily didn't affect staff costs a whole lot, but maybe advertising, resources.
I'd clarify a little bit. It was almost 2 tiers. We have people
Yeah.
that do like the actual enrollment into Well Woman program. So that's a cervical and breast cancer screening program. And we serve 7 different counties. We are like the coordinator. So we still are able to provide that service. We still connect. So someone from Kathy's team does the actual enrollment, and then the public health nurse does any sort of follow-up. So if there is atypical test results, she helps kind of walk them through those next steps and what to expect. So it's kind of like a 2-tier level. And then we also did outreach. So just the general, and it would be 7 county-wide outreach to not only the providers, so the medical centers know that Well Woman is an option, but then also to the general public. And that's something that we've decreased because we want to focus the priority on like actually connecting people that need the services. And then kind of like seeing how that budget flows throughout the year, and hopefully having some capacity to do a little bit of outreach. I mean, it's easy to send an email to medical systems, so we're continuing to do that, but any like bigger scale things, then we're not. Our immunization funding has also been cut, or is kind of continuing to shift. So we continually are like prioritizing, like what is the biggest need in our county? Let's tackle that first. What do we have available? And then we're going to backfill. And people are being reassigned very frequently. Their jobs, not jobs, their priorities of their day-to-day work.
Okay.
Yep. And like for like the,
We're also holding on our drug-free communities coordinator position, family support, not knowing what's happening with funding on those.
Yeah.
So we've got vacant positions that are grant funded or mostly grant funded that we're just sitting on because we're not sure what's happening.
Got it.
We don't want to fill them and then have to lay them off.
Sure.
and with like the Well Woman, like Helen mentioned, the person on my team, that's a big part of my team's job anyways, is to get people enrolled in benefits. So we kind of shifted what that looks like, because they would normally do that anyways. That's
Sure.
part of their role with other stuff. We have some other grants that help fund like forward health outreach, and this is a forward health program. So we kind of looked at what that shift looks like so that we can make sure we can still do some of those other things, because my staff member, that's part of their role anyways under their other funding. So we're able to maybe, instead of it paying for more of my staff, we can shift it over on the public health side to do that other stuff. So being mindful of that too. It just, the positions are just so diverse, and some staff come out of so many budgets. We're always looking at it to make sure we're maximizing it
Right.
to what the needs are. Yeah,
Shells.
yeah, essentially that
Okay.
is kind of, yeah.
So I mean,
Thank
the public won't see a big change other than a couple of these that were hit pretty hard. I mean, even though we're gonna lose $134,000, it's not, it was pretty small in the scheme with the exception of 2 or 3 big hits.
Our goal is to maintain the level of public service, but there's been a lot of shifting and reassignment, and that's not a fun thing to do.
No.
So, we've had a lot of unhappy people because we want to keep those people on staff, but we've had to totally change their jobs on them, and that's just not ideal, but what it is.
Thank you.
Do we have any other questions or comments? Thank you for all the information and your work on this. And, I certainly appreciate everything that goes into doing the best you can with what you've got and trying to make things work. Certainly. So with that, our next agenda item is number 10, our administrators update.
Yes, Madam Chair, just a couple things. As I was reported, sales tax for August was down 3%. Still up 8.9% over the year, overall with that. So we're still planning on budgeting flat for that for income tax. There was an update playground equipment has been installed at Apple River Campground. With our online reservations and cleanup there, our revenue is up over 80% for the use of that campground. So that's going very well. And with this committee, I reported this to the other ones. As we mentioned with the the big beautiful bill and SNAP and how that's gonna be administered. One of the things states will be penalized if they have an error rate above 6%. They did we are part of a consortium of 10 economic support that goes through this. The state did an audit on that. And the payment error rate for the consortium is under 1%. It's 0.88. The one that was pulled from Polk County was 100% correct. So they're doing very well. So I just want to shout out to economic support and Dan Peterson's group out there that they're doing a great job. Our state error rate is 4.1% for payment, and the case error rate is 7.18 in the state, but that's being driven by Milwaukee on those for their error rates. But our consortium of 10 counties is fantastic. The case error rate for us is 1.49%. So hats off to them. And then also, I plan on attending the WCA conference there in September, coming up here. So some time with that. So that's all I have.
Brad?
I have to ask, how much do we spend on the Apple River Playground?
I do not have that number, Brad, but I'll get it to you.
Okay.
Any other questions for Mo on that? If not, we'll move on to item 11, which is our update regarding the ADRC commercial kitchen project.
Yes, as I reported last time, staff met with down at Golden Age from ADRC and Dana down at Golden Age. Right now, they're still working through the details on that and how that's going to look with their licensing. The big thing is timing on when the Meals on Wheels have to go out and in between their breakfast service and their lunch service and how that all works. So not a whole lot to report on that, but we're making some progress.
So the progress though is towards actually trying to utilize that as the kitchen?
Yes,
Yes.
at least to try to get 100, 150 meals out of there to alleviate that. Speaking with ADRC, Polk County's Meals on Wheels is not crisis right now, so we have time to do that. So we're in good position with those.
You said, so they want to get 100 meals out
100, 150 to do a pilot to see how that works and how they can get them out.
compared to what do they do right now out of Joy? Do you
I
know?
believe it's a couple hundred.
Okay, an update on housing?
Housing currently met with the administrator from Amory on their application and their funding. He's currently working with their contractor and themselves on how to utilize those funds. And once he has that set, we'll have the loan agreement paperwork signed and get them the funding for that. How to apply that. Village of Balsam Lake was sent the application for a project for them. We have not received that application back yet. So we stand with those.
Okay. Number 13, communicable disease report. Helen?
All right, so our tick-borne illnesses are starting to trend down a little bit. In August, there was 17 confirmed tick-borne illness cases. Typically, we see it trend down in August and September before increasing again in October and November. So we're continuing to watch that. Respiratory disease activity is low for now. In August, we did have a new case of pertussis or whooping cough. So this is the first case in Polk County since May. So we're hoping this isn't the start of something for the school year, but we're working with that. And then on the 28th of August, one of the bats that we sent down to the State Lab of Hygiene for testing came back positive for rabies. So we did messaging around that. Any humans involved with that are being treated, so that's all good. We did have blue-green algae bloom in Big Butternut Lake, so we put a water advisory on that lake in Luck. I believe it lasted for 2 weeks before the bloom dissipated, so that's been lifted. And then there is active measles cases in Wisconsin now. So as of September 3rd, DHS has confirmed 24 cases of measles, all within Oconto County. Now, 100% of cases are unvaccinated, and 2 out of the 24 have been hospitalized. And then there was another press release that went out that at the beginning of August, there was a traveler potentially exposed measles in St. Croix County because they stopped at a gas station. So there was that messaging that went out. And those are the highlights.
So I just want to give a shout out to Helen. She recently worked with the city of Amory on creating a DORA district, and don't ask me what that stands for.
Designated outdoor refreshment area.
Yeah, okay. So basically what that is something that permits people to drink alcohol outside of the designated area. So I just want to give a shout out to her. We appreciate, her input. She worked well with everybody, and just thank her for that.
Thank you.
Okay. Our legislative event report, Johnny,
Ooh,
he's got a bunch.
I just got our resolutions UPS on Saturday. And I'm trying to read through this. I went into the night last night. Sunday, the 21st at 3:00. Sunday. I thought this was gonna be on Monday, and here we started this on Sunday this year. So our state, Wisconsin counties is starting, our annual convention is starting Sunday at 3:00 at Wisconsin Dells. And I'll be introducing, I got them earmarked here if anybody wants to look at them afterwards. I'll be introducing 6 resolutions from Polk County. 3 of them are from our Health and Human Services. And these, how this all starts is if when a resolution starts from our county here, I take it, I'm the liaison for the legislature. So we have I'm on the steering committee, so we pass them at the steering committee, and then it goes to our officers, and they either approve it or not approve it. But these 6 are all approved. Last year I actually had 7, and all of them have so far been approved without any dissension. So I hope we do as good this year as we did last year. The thing that confuses me, if you remember, and I talked to Don Stark this morning, fire chief from Osceola. If you happen to remember, last year I introduced a resolution, all of our EMS and our fire departments along the northern tier, like from Bayfield, all around. I think there's about, I don't know, 14 departments. I had this resolution to fund 1.5 cent per capita out of the big reserve fund, budget reserve fund that Polk County, or that the state did have. And I talked to Don, the fire chief, this morning, and what they did do is, and I don't know how the legislature came about it. It was for EMS and fire departments. Well, EMS, they passed it. And like the Allied Fire Department, or Allied EMS, they got 34,000. Village of Osceola got 36,000. And so somehow the EMS part of it was funded and the fire departments weren't. They got nothing out of this resolution. And like, I think Balsam Lake now, I think they just merged with Unity or Milltown rather.
And Centuria.
Yeah, because Balsam Lake, I think they only had 2 active volunteers. And so, man, our fire department, so I'll try and get some information, bring that back to you as to what's being enacted. What I can tell you is the legislature did pass a $12.4 billion budget. And the governor did sign that. The governor's request was 19 billion. And the good part of that for Polk County is in our 26 budget. Right now, I believe we have 1 juvenile in our major facility, and we were paying $2,500 a day. And this has been in effect for quite a while. And we came with this resolution of $500 a day. It passed. The governor signed it. Next year, I think it'll be $600 a day, and then $750 in 3 years. But that's a direct help to our final budget, if I added that right, that's gonna save us somewhere around $800,000 in our, in our county budget, so helps our levy situation. Anyway, I've got all these earmarked here, what I'm gonna introduce, if somebody wants to look at them. Rather than take up any more time.
Well, thanks for your work on that, John. You're our go-to person.
Well, there's a lot of negotiations in the steering committee. In the steering committee, as you know, we've been trying to get a facility, a mental facility, rather than, right now, you know, we gotta transport way down to Andover or someplace. And our sheriff's department now has to have a deputy driving, and they gotta have another deputy riding along, because here about 5, 6 years ago, somebody escaped down there. And
Yikes.
I remember one of our legislative committees, Mr. Sheriff Knudsen from St. Clair County, he just broke down in tears at the meeting, and he said, I just don't have enough staff to maintain my department and put my deputies on the road. But where we're lacking there is every year, these 28 counties have had a resolution that they want the state to fund the operation of this facility. Well, that's not gonna happen, I'll tell you guys, and I'm trying to tell these people, until we take the bull by the horns and say, yeah, well, we're gonna fund the operation. There's two-thirds of the territory in Wisconsin and 1/3 of the population up here. Down here, you got 1/3 of the territory and 2/3 of the population. They're not gonna run an operation for us. We gotta find a way to fund that ourselves. They have approved enough money twice now in the bienniums to either rent or buy us a facility. We should have had one at either Baldwin Hospital or someplace. Right now, I think we're zeroing in on a facility.
Well, thank you. Thanks for that update, John. Identify subject matters for our next meeting. So we already have talked about, we're gonna take a look at a chunk of that ordinance. October, we have on our work plan, we have budget amendments and a medical examiner update. Something I would like to see us address, and I don't know if it would be next month would be the appropriate time or not, but something that kind of came to the forefront is, to me, with the creation of the DORA district in Emery, is underage drinking, as well as alcohol abuse in general. I think I heard at one time, and I could be mistaken, that actually alcoholism and alcohol abuse is probably the number one thing in Polk County that impacts our budgets and our human services department. But it seems like we never talk about that very much. So, you know, I guess I would just like to touch on that, find out maybe what those impacts and those numbers are. And like I said, I don't know if that's appropriate for next month or not, or we got enough on our plate, or maybe we want to hold off until all of our alcohol compliance items are completed, but I would like to talk about that sometime.
When do you think we'll?
Tanya, excuse me, don't you have a report? You actually go to the different establishments and have somebody like undercover? We've fared fairly well on selling on underage cigarettes and alcohol, haven't we?
Yeah, I think we could give that report in maybe November. We should be all wrapped up
Okay.
with the compliance.
I thought we made progress on that.
I remember getting the compliance report last year and talking about that. So does anybody have anything else that they want to see? It sounds like tackling our ordinance is
I'll have a
gonna,
resolution for
Oh, I'm
economic support.
pardon me?
I'll have a resolution for economic support. It's a template resolution to support some funding for some of the impacts the federal budget is going to have on them.
Okay,
for the amount of, it has to do with their workloads and the cuts and funding. Be presenting that.
okay. Let's look at that as well. Bill?
Please have a donut on Johnny B's birthday.
Well, I'm going to the party.
Well, by the way, on a personal note, my kids are having that UW Wanderers, they're having a 90th birthday party for me. I think 1 to 5 or something at UW Wanderers on the 20th. And I'm probably gonna have to leave early on my own party because I gotta leave for Wisconsin Dells 6 o'clock in the morning.
Take a couple donuts with you up for the road.
You don't care if the rest of us carry on
No,
after
you
you're
guys will
gone.
probably be having fun after I'm gone.
Talked about Elk.
Yes, we will.
Before we adjourn, I just wanted to mention quick that myself and Gabe attended the open house at Golden Age Manor for the new hospice suite on Friday. And I didn't know, Gabe, what your impressions were, but boy, they had a nice turnout there.
It's fabulous.
Turnout was great, and what they did to fashion those 2 rooms is just gonna be a great asset to our community to have something like that.
Yes, very,
Very nice.
yeah, very nice, very homey. Really with comfort, in mind. They also had, Adare had set up some kind of related type of services and vendors that each had a table for people to visit and learn more about what they have available and what they can do.
We need to look at the November meeting date, partially for budget purposes, but also it's Veterans Day.
Oh, okay.
Don, we're gonna push it a week before?
A week up, I believe those meetings are gonna be done because our county board meeting needs to be on Wednesday, the 12th. Leave at 1 o'clock due to we cannot have a meeting go past 5 o'clock or something. I don't know what they.
Right now, it looks like it's scheduled for the 4th.
I've been in that after 5 o'clock meeting, so you're absolutely right.
So we were looking at the 4th, right?
That's what's, yeah, that
Oh,
means.
it's on there already. Okay. We just wanted to make sure.
Yeah.
So
Is our final budget approval still that we have to pass the budget the second Tuesday after the first Monday?
Correct, which is Veterans Day. So the
Yes.
meeting moves to Wednesday, but due to our rules of order, the meeting will be at 1 o'clock due to our rules of order, so we cannot have a county board meeting past 5 o'clock.
Good, we'll have a day meeting like we used to.
1 o'clock on November 12th, Mo?
Yes,
Okay, and then HHS is still gonna be 9 AM on November 4th?
yes.
I got it. Okay, if we don't have anything else, then I'll entertain a motion to adjourn.
I so move.
Okay,
Coffee and donuts?
no discussion.
And donuts, help yourself.
I'll call for a vote. All in favor? Aye.
Aye.
Okay, aye. Motion carried. We're